Did you know obesity is a disease that can be addressed? Have you tried to lose weight with little or no results? Do you or a loved one suffer from high blood pressure? Do you have type 2 diabetes, high cholesterol, or heart disease? Is your weight causing joint problems, pain, and discomfort? Are you tired of being discriminated against because of your size? These and other problems are now being addressed through a procedure called the gastric sleeve. It is a revolutionary weight loss surgery that is now available in Northwest Florida. Obesity has been recognized as a disease. Now you can beat it and step into a new life.
It's really simple. The surgery's simple. There's very little pain and the results are amazing.
I chose to do surgery because I was still young. My son was young at the time. I wanted to be able to get out there and enjoy doing those things with my son that a lot of other parents were getting out there and doing that I couldn't do at the time. Or if I did it, I was only able to get out there and play ball for a few minutes versus getting out there for an hour or two or playing. I wanted to be able to make sure I was still around for my son when he got to graduate from high school and get married and all that other kind of thing.
At the beginning of every diet, I felt so enthused. I just knew that this was going to be the diet, whether it was the low-carb diet, low-fat diet, the cabbage diet, the chocolate diet, whatever diet it was, I just knew this was going to be the one, and I always lost the weight. But I always regained it, and some more. Very frustrating. This thing gave me that tool that since I did lose the weight, I could learn how to keep it off.
If you do the procedure and you follow the aftercare, you are going to get results.
I'm here with Dr. Althar, a local surgeon here in Northwest Florida who has been doing weight loss surgery for many years. Doctor, welcome, and tell us a little bit about your background.
Thanks, Tom. I moved here 21 years ago and started my practice of general surgery. In 2002, I introduced laparoscopic weight loss surgery to this region. And since then, many hundreds of patients have benefited. Their high blood pressure and diabetes are gone. They have more energy. They participate in a more active lifestyle with their patients. And they're going to live truly 10 to 15 years longer.
Now, doctor, this is a gastric sleeve, and it's really a new way to addressing the disease and weight loss. And two questions I have is, what really takes place, what happens, and who is a good candidate for this kind of surgery?
Gastric sleeve surgery is a new way to approach morbid obesity. I've watched this operation for the past 3 years, and we now know that gastric sleeve results in better weight loss than a lap band. The weight loss is as good as a gastric bypass, but it has fewer complications, both short and long term. Patients with a BMI over 30 with significant health problems such as high blood pressure, diabetes, heart disease, sleep apnea, these patients will be significantly improved with weight loss surgery.
Now, this really is a disease, isn't it? And a lot of people are discriminated. Tell us the real story about this, though.
Well, doctors have been slow to change their preconceived notions. What they learned in medical school and residency is just plain wrong. Morbid obesity is a disease. It's not the patient's fault that they're obese. This is a genetically related disease process. Patients can't pick their ancestors. It's not their fault they're obese. These patients have a disease, we treat it as a disease, and we have an effective treatment.
Sadly, this is one of the areas that is very discriminated against, isn't it?
Yes. In America, discrimination against obese people is the last socially acceptable discrimination. You'll see it in restaurants, you'll see it at work, you'll see it at the shopping mall. These people are discriminated against. At my office, we treat it as a disease, and we have a treatment that works.
I do not have to take medication anymore for my heart, for high blood pressure. I haven't had high blood pressure since I lost the weight. I can literally run now, play sports. I can do things that before I never could do, like simple little things that a lot of people overlook, like sitting in the movie theater seat. I can fit in them now. Riding rides with my kids. I remember taking them to Disney World, and lo and behold, I actually could fit in the ride this time. And it's got to watch my children graduate and move on in life. I'm healthier, happier, and if I had to make this choice to do this again, I absolutely would do it again. And I absolutely would pick Dr. Althar. No regrets there.
The reason I had it done is because I know this year I turned 50 and I still was like a lot. I mean, I was not obese, but I was definitely overweight, and I have knee pain, back pain, swelling feet. I felt miserable. My weight alone just made me feel so miserable. And I had tried all kind of diet for years, and so I decided I want a change. I want a permanent change, and that's time for me to do it.
If you or a loved one have considered bariatric surgery before, it's now time to take a closer look. This is a one-day procedure with minimal pain and discomfort.
Did you know that obesity is a recognized medical disease? Are you tired of being discriminated against because of your weight? Are you having medical problems that you need to resolve? Do you want to get back to your old self, confident, happy, and healthy? Today you can make this a reality, and it's cheaper than Jenny Craig or Nutrisystems, and it's permanent. Call the Weight Loss Surgery Center of Northwest Florida at 850-995-0875 to get started. Enjoy a personal, private, free evaluation to see if this procedure is right for you. Learn about your options and explore how you can significantly improve your health and enjoy life. The evaluation is free. Call 995-0875. When do you want to start?
What does obesity do to the body, and why is it so important to actually get rid of this weight?
Well, let me address the terminology first. The term morbid obesity is not a derogatory term. It has to do with the morbidities or diseases that are caused by obesity. And those are diabetes, high blood pressure, coronary artery disease, congestive heart failure, infertility, severe headaches, kidney failure, osteoarthritis, sleep apnea, and a greatly increased risk of cancer. These are what cause people who are obese to live 10 to 15 years less than the normal weight population.
That's unbelievable. Why wouldn't people, when they hear this, why wouldn't they just be running and getting it dealt with?
Their doctors, as I said before, often don't know the science and the research behind weight loss surgery. They don't know that surgery is such an effective treatment. For example, diets of any nature, any means, have a 95% failure rate. And failure and success are defined as losing more than 50% of excess body weight and keeping it off for 3 years. So diets have a 95% failure rate. Surgery has more than an 87% success rate.
Dr. Althar, tell me the steps in this procedure and how is it different from other surgery?
The lap band is a foreign body that is wrapped around the stomach, much like a corset. The weight loss achieved is not as great as the gastric sleeve. Complications such as dilatation or dilation of the esophagus can occur, and this is not reversible. The lap band can slip. It can erode into the stomach or other organs. It can become infected. It requires a lot of adjustment through a port under the skin. The skin can become infected. The port can become infected. If those things happen, it has to be removed.